Welcome to our third episode of Navigating Today's Normal, the Connected Mind and Body. Today, Dr. Murray Lowe is going to show you the major connections between the healthy body and the healthy mind. Dr. Lowe is going to give you the medical evidence of why maintaining a healthy body for maintaining a healthy mind is critical. Sustaining well-being and happiness in times of stress can require you to remember that both physical and mental health go hand in hand. Murray is a doctor of education in applied physiology and is nationally recognized. He has received the National L. Kent Smith Award for his significant and unique professional contributions, having had a major impact on the delivery of cardiovascular rehabilitation. He has served as the president of the American Association for Cardiac and Pulmonary Rehabilitation. From an early career as a professor at York College, CCNY, he recently retired after 30 years as director of the Tully Center for Cardiac Rehabilitation at Stanford Hospital. In his retirement, he currently serves as the director for Burke Rehabilitation Hospital Cardiac Program.
First, I want to thank you for inviting me here to present in the New Canaan community and to talk about my passion, which is physical activity, exercise, and fitness. So today we'll talk about exercise as medicine, the body-mind connection. I think we've got a really worsening situation in our country. In the past 100 years, we've learned to sit more and move less. And that has really been quite painful to our health and also to our minds. More so now, especially with the pandemic that we're all dealing with. You see all these remote controls on these slides. And I think that's an indication that we're sitting even more as people are afraid to move, to go outside, to go back to their physical activities, to their exercise programs. So I'd like to share with you today a little bit about some research that we have and perhaps get you to rethink your current levels of physical activity. And the first question we have is, are you sitting too much? And my guess is for many people, the answer is yes. And you see that kind of skeleton and bones on that chair, and I think that's dangerous for all of us. The more we sit, the greater is the chance of additional health risks. So let's just look at a few brief studies to see what research shows us about the benefits of movement, of physical activity. And first, I think there's a very, very important message, and that is that any activity counts. Some people think they have to go running or jogging. Really, almost anything you do that's not sitting is going to be beneficial for you. And I think this is a really classic study that I'm showing you here. It was done on a group of patients with heart failure. And they provided them with the ability to either go on a bicycle and exercise on a bicycle. And they took another group and said, you know what, let's go dancing. In this case, it's a waltz, probably because the study was conducted overseas. But I'm sure there are still some people who may remember how to do a waltz. But it was an interesting study because we had heart failure patients. We looked at their exercise levels, and we looked at what the results was when they danced versus the group that typically would go on an exercise bicycle and exercise. So it was a study of about 130 patients. Some of them, as I said, were on a bicycle, and they worked at 70% of what we call their aerobic capacity. And the other group, as you can see on the slide, did some slow dancing for 5 minutes and then some rapid dancing for 3 minutes. But the total was about 21 minutes of dancing and about 30 minutes on a bike. So actually, the dancing group did not exercise as long as the bicycle group did. And this graph shows very nicely, you can see that the heart rates, if you follow that red trend line on each of the graphs, you can see that the heart rates were almost identical whether one went to waltz dancing or one was on a bicycle. And the results, first of all, they measure their quality of life. Do I feel better? Do I enjoy this? Do I feel better about living? And you can see the results for the dance group were identical as the results to the exercise training group, whereas the control group that didn't dance or exercise on a bike, there was no change in their quality of life. In addition, and this is rather fascinating, is that their aerobic capacity, one's ability to take in more oxygen, which is probably the best measure we have of cardiovascular fitness, actually was higher in the dance group after 8 weeks of training than it was in the exercise group on the bicycle. And you can look here, and that's in spite of the fact that the dance group only danced less time than the bicycle exercise group did. In fact, it was a 43% difference. So the conclusions here were that after 8 weeks, the waltz dance group improved their functional capacity, that is their aerobic capacity, how much oxygen you can take in, and thereby improve your cardiovascular fitness. They improve their quality of life, the ability of blood vessels to relax, which is what aerobic exercise does, and they improve their quality of life. And the second bullet you see on this slide, it says, the emotional dimension of quality of life and the adherence of protocol were both higher in the dance group. In effect, what this is saying is, they enjoy dancing even more than being on a bicycle. And this is my point, that there are many things you can do that give you pleasure, enjoyment, and yet are beneficial. It doesn't just have to be to go out and run a marathon. So let's look at another piece of research here. And here I say, what's good for the heart is good for the head. And people sometimes kind of cut this from down here and they separate it. And we're not separated. We're rather integral. And one of the first studies I want to show you is an interesting study, because it's important to realize that the more fitness you have, the greater benefit it has for you long term. In this study, it was rather interesting. They took 6,000 veterans, and every veteran went on a treadmill test. And they said, let's see how long you can stay on this treadmill. And we're also going to measure how much oxygen you can take in, because remember, the more oxygen you can take in, the greater will be your aerobic capacity, i.e., that is, the greater will be your cardiovascular fitness. And then they said, you know what, okay, we'll give you a treadmill test. Let's sit back and let's wait 10 years. And let's see how many people develop dementia or Alzheimer's or cognitive dysfunction. And let's see if there's a difference between those who are fit and those who are not fit. And what they found out really, really very classically here was that you look at that bar that I've outlined in red, that's the group that has the lowest aerobic capacity, less than 6 METs, which is just a terminology we use for how much oxygen you take in. And you can see that that group had an over 400% greater risk of developing dementia, Alzheimer's disease, and cognitive dysfunction. That's a huge number, over 400%, while the group with the highest aerobic capacity, the bar that shows greater than 12 METs, had the lowest rate of developing dementia, Alzheimer's, and cognitive dysfunction. And not only that, but exercise capacity was independently and inversely associated with Alzheimer's and dementia. That means you couldn't blame it for other reasons. It was strictly based on your level of fitness. So fitness is important. Now, we know now from really some good scientific work that some people have really a predisposition, a genetic predisposition for depression. And the question is, well, if you already have a genetic predisposition, can I change my genes? Will exercise have any effect on that? And this was a very nice article that was published in the New York Times by Gretchen Reynolds back in November of 2019. And what it said was that it was less likely to develop clinical depression, even if you were genetically predisposed to depression. And the study was really on a very large group of people. It was over 400,000 people. In England, they have something called the Biobank study, which collects data on hundreds of thousands of people, and they also can look at DNA snippets and look at which of the population are prone for depression. And what this study found was that people who exercise were no more likely to develop depression than inactive people. In effect, physical activity neutralized much of the added risk of your genes. So we say propensity is not destiny. Just because your genes say that you have a propensity for something, it doesn't have to happen. You have some control over it. And exercise very clearly here, you ended up with the same risk of depression, even if you have gene snippets for it, as people who didn't have it if you exercised regularly. Another study going back to this whole idea that it doesn't have to be just on a treadmill or walking or running or marathon running or even dancing, but even lifting weights. And some people love resistance training, which is so important, especially as we get older. Not only do we lose aerobic capacity, but we lose musculoskeletal strength. We become weaker. And in this case here, as this was a randomized here meta-analysis. A meta-analysis means rather than taking one study, we take many studies, we combine the data, and we look and see what are the results. In this case, it was 33 studies looking at almost 1,000 people who lifted weights. And what we found here was that resistance exercise training significantly reduced depressive symptoms regardless of people's health status or their total prescribed amount of resistance exercise and whether or not they were significantly improved strength gains. So lifting weights, strength training really does reduce depressive symptoms. And lastly, or almost lastly, I want to say that, we're living in this coronavirus depression era. People say, I'm bored, I feel depressed. And I tell people the best thing you can do is move, physical activity. And I'll give you a classic example of that because I come from the clinical area of cardiac rehabilitation, where I've been a director of cardiac rehab in major hospitals for almost 4 decades. And this was a classic study here looking at people who come into cardiac rehab and have depression. And cardiac rehab usually is a 12-week program. You come in 3 times a week, but the foundation of cardiac rehab is exercise, combination of both aerobic exercise training and resistance training. So what this study did was it took patients here who had heart disease and it followed them over that 12-week period. And there were about 522 patients here. About 2/3 were men, 1/3 were women. But if you look at the bottom of that graph, you can see that the prevalence of depressive symptoms fell 63%. That is more powerful than medication people take for depression. In other words, moving, exercising during this pandemic virus is critical for your health, for not only your body, but importantly also for your mind. So that you can see the reductions were significant, not only for reductions in mortality, but reductions in depressive symptoms. And even a little bit of exercise had benefit for this group in this research study. So my final messages to you is physical activity is vital for your mental health and your physical health. And exercise is like medicine. It's a pill. And it doesn't matter whether you play tennis, whether you go bicycling, whether you go walking, or whether you step up and down on a bench for 5 minutes, for 10 minutes, for 15 minutes. It is low cost, it's low technology, and activity is great medicine. So, I always say that physical activity is low tech, low cost, it's great medicine. And low technology simply means even at home, you don't necessarily need a gym membership, you don't need to be in this pandemic working out with 30 people in a room. You could do a simple, what I call step-up exercise. You can purchase one of these step-up benches, which are like 12 inches high at a Home Depot or wherever for like $10. And stepping up and down on that bench maybe once every 5 seconds, once every 10 seconds, not only would strengthen muscles in the legs, but begin to get your heart to work harder and to improve your cardiovascular fitness. You can start with 1 minute of step-ups. You can build up 10% a week to 1.5 minutes, to 2 minutes, to 5 minutes, to 10 minutes. A 15-minute workout on a step-up bench would be the equivalent of going out and taking a walk or even a slow jog. And my point again is almost any movement is going to be of benefit for you. So I ask you to please look at this cartoon image very carefully. It's a doctor speaking to a patient, and let's read it together and see what it says. What fits your busy schedule better, exercising 1 hour a day or being dead 24 hours a day? Personally, I prefer exercising for 1 hour a day. I just wanted to add a couple of other thoughts. We live in one of the most overweight, obese countries in the world. We measure that with something called BMI, body mass index, which is a composition of your height and your weight. We have 1/3 of the population in this country now is obese. And people sometimes come to me and say, it's probably my hormones. Or they come with other reasons why they cannot become physically active or change their diet. And I tell people, the evidence is overwhelming. This is not about your genes. It's not about your thyroid. It's about taking responsibility for your health. The most powerful thing you have is your ability to take responsibility for yourself. Because people go and say, I'm a victim. It's my wife's fault. She doesn't cook adequately. Or the medication I took didn't work. Or the surgery didn't work. Or they blame their children. And I tell people, take responsibility for your health. For example, the most powerful thing you can do is to get moving. Become physically active. 5 minutes a day, then 10 minutes a day. Insert it 3 times a day. But you have the ability to stay healthy and to overcome this obesity crisis. We will not solve it with medicine, surgery, or the best doctors in the world. We will solve it by changes in our lifestyle. Thank you very much for inviting me and providing me with this opportunity to share some research with you. Please sit, then stand, then get moving. Thank you.
We've just heard Dr. Lowe talk about a healthy mind and a healthy body. And he really emphasized the importance of activity. And some of those activities can be professional activities in a gym. But fortunately, many of those activities can be done at home for little or no cost. And I'd like to just take you through 3 of those activities right now. Number 1, we'll look at little stair climbing. Number 2, we'll look at a little resistance training with weights. And then number 3, we'll talk about sitting in a chair and still getting exercise. And if you're not believing that's possible, I'll be able to show you that it is. First of all, let's talk about what Dr. Lowe had talked about, which is stair climbing. I'm sure many of our homes do have stairs in it, and for those of you at home, I'd recommend using the banister. But Dr. Lowe talked about setting up a simple regimen of a few minutes a day on doing stair climbing, perhaps a minute to 3 minutes to 5 minutes to 10 minutes, and something as simple as this. Three simple repetitions. I could advance it to 5, to 7, to 10, whatever it happens to be, and progressively go up and down stairs. Simple, easy, free, and it keeps you moving, and it keeps you healthy. A second very interesting exercise is resistance training. And here's an example of simple resistance training, a simple bicep curl. You'll note, of course, that I'm standing while I do this. I suppose for those of you at home, if you wish to do it sitting in a chair, you could. And I'm sure Dr. Lowe would tell us that the result is the same. There's numerous variations of resistance training, as I've just demonstrated, and you can discover them all. A simple, easy, but very effective training that you can do at home for a healthy mind and a healthy body. And finally, my personal favorite, sitting in my own comfortable chair, as I'm sure you're doing right now. A healthy mind and a healthy body through active exercise is still possible. And let me demonstrate that kind of exercise. Left foot out, left foot in, right foot out, right foot in. Shake them all about. Simple repetitions of this, sitting in your most comfortable chair, are beneficial and effective. And it is one more example of a simple exercise that you can do at home for a healthy mind and a healthy body.